before, big meets, or, tennis player who before any big meet would come in and make sure and get a nutritional IV, because it just helps vitality, which of course that's what winning sports is about.
Right. All right, so let's say now, okay, you've done your best prevention and now you're into a trauma event. You've sprained your ankle, pulled a muscle, bruised your shoulder, whatever those ailments are that come with your sport. Our approach is much different than shutting off. So again, it comes down to, what is that naturopathic approach? We want to treat the physiology. We want to augment your body's response to an injury and aid physiology. Where Western medicine is really coming in and saying, nope, that pain, we got to end that pain. That will slow down your healing process. And we're not saying not to get you out of pain, but pain is not the issue. Pain is a response, your healing response to an injury. What causes that pain? You want to go through that whole...
Yeah, well, one thing that I think is unique in the naturopathic approach to injuries like this is that generally we are trying to, in other conditions, we are trying to reestablish balance. And with trauma and inflammation, what you have is a localized imbalance that, in fact, we want to help support, because it's the imbalance. The body is creating a local imbalance as part of the healing process. All kinds of new, immune cells are coming in, blood cells are coming in, lymphatics are coming in.
And that's the swelling.
Swelling is happening. So there's a localized imbalance that, in fact, we don't want to prevent that. We want to facilitate that process happening. So if blood is trying to get there, we want to help blood get there. If immune cells are trying to get there, we want to help that process. Any of those things that we can augment to help the body get done faster so that balance can get reestablished later.
So, a word on that. So you get all of these cells coming in, you got the debris and the lymphatic congestion in the area, and that's where the pain comes. It starts pinching on your nerves. So one item that I see people just do not get correct is how to ice properly after an acute injury. Icing is appropriate 24 to 48 hours after the initial insult. And you don't want to just numb it, so that goes into cutting your physiologic response. I made up a 9-minute, 21-minute rule. Why? Because I think you can remember that. It's an odd number, first off. 9 minutes of ice per half hour is what you want to do to an area. I find people will put the ice on there and they just numb it. It feels good because pain goes away, but that slows down because you really want to get the blood. You want to get the new blood with the nutrients into the area and the old blood and the old lymph out.
Right.
So we're using a little bit of hydrotherapy. This is just ice therapy 24 to 48 hours after. Then you can start doing some hydrotherapy, alternating hot and cold, and it works just like a pump. You bring the new blood in with the hot and you push the old blood out with the cold, alternating hot and cold. 3 minutes of hot, 30 seconds cold. Do that 3 times per cycle. Do that as much as you need to for your injury. Just a quick aside, because I see too many people will slow down their healing process with icing it.
Right.
So that's a big component, and that's not the only thing that we've got, but that's a big one. That home treatment, you can definitely start out with that. Other components that we do, in Chinese medicine, we talk about blood stagnation, and that's literally what it is. You get a swelling around a joint, and there's a stagnation. So we use acupuncture to move the blood. We use physical medicine to move the blood. We use the hydrotherapy to move the blood.
Physiotherapy.
Ultrasound, interferential, things like this that really can help speed a recovery and maximize an outcome for you.
And acupuncture in this context, this is one of the most dramatic instances where acupuncture can produce almost immediate noticeable results around injuries and pain associated with injuries, but swelling and pain and all those mobility. It is not uncommon at all to have someone come in with an injury and within minutes of having needles placed appropriately, they have dramatically reduced pain and dramatically increased range of motion in, say, a shoulder or an ankle or whatever. Acupuncture really facilitates the flow of of blood and nutrients and just energy through a place that is stagnated, and that stagnation represents itself as pain and swelling and all those things. So,
yeah. So, I mean, you know, we can have countless stories of people that have come in. You know, just one that quickly comes to my mind, a gentleman that had 15 years of knee pain, arthritic knee pain, so not really sports related, but I'm sure it was related to his running around as a kid and the wear and tear on the joints. In, you know, about 5 to 6 visits, his knee pain totally went away. And, you know, it's pretty remarkable being a practitioner and using these therapies and seeing those results day in and day out. You know, I still am amazed that it works so well.
Right.
And, you know, it kind of gives me chills a little bit.
I know,
like,
it does.
geez, it works.
I try not to look like I'm astounded every time, but sometimes
it is. You know, and unfortunately, it doesn't work that way every time.
Right.
But when you get those kind of home runs, I call them, it's really gratifying.
And I think one thing to note about acupuncture, a mistake that a lot of people make, is that they don't do it enough. That they have, you know, shoulder pain and they get acupuncture once or twice, and they say, it didn't really help, and so they stop and go away thinking that acupuncture doesn't help those situations. In fact, we are commonly doing with an injury. It's not uncommon at all if it's an acute injury to do acupuncture 3 or 4 or even 5 times a week, because it's that repetition that gets the results. And if you can stick with a schedule like that early on in an injury, it really can make a dramatic difference. You know, after, say, 12 treatments with that intensity, it can make just all the difference in the world. And not just with acute, also with chronic. If somebody has severe chronic pain, the intensity of the treatment kind of defines the success of the therapy. So if you've had acupuncture in the past and you tried it once or twice and it didn't seem like it worked, that doesn't mean acupuncture doesn't work. It just means that the schedule for it wasn't correct.
And perhaps the style.
Or the style,
there are different styles.
Yeah.
I know we've changed our style more into the balance method and kind of distal points, and it really seems more effective for pain. All right, now another component that we think people should have with them at their sporting events is a little bit of a homeopathic kit. It's easy enough to travel with. We're going to list out some remedies and some general approaches. You can find these in any homeopathic book. But the ones that we've seen really work for acute injuries. The first one that comes to mind for any trauma is arnica.
Arnica. Everybody's got to have trauma.
And we kind of joke about it in that it's one of the top prescribed homeopathics in our clinic.
Yeah, of course.
For bruises, blunt trauma, in any type of acute injury like that.
Anybody with kids needs to have arnica.
Oh yeah, the fall down, bruises, bumps at home. It really can do the trick, and it really can really clear bruising pretty quickly.
Other ones, Ruta is one that comes to mind. Ruta is specifically for tendons and ligaments that happen to get torn or sprained. Ruta is specific to help repair that situation.
It's calendula tincture.
Absolutely.
For abrasions, scrapes, you're sliding into second, whatever that is. You put it topically, it helps, one, clean the wound out because it's alcohol-based, and then second, just helps the skin repair itself.
Ledum is one of the homeopathic specific for puncture wounds. So if there happens to be some kind of trauma where the skin has been punctured, ledum is very much indicated in that situation, can help swelling and pain and kind of mitigate all those things.
You got hypericum, which is St. John's wort, not used for depression in this case. Is actually the original use of it was for shooting nerve pain or crushing injuries. You know, you get your foot stepped on, your hand stepped on, whatever that crushing injury or any shooting nerve pain. Hypericum is the remedy of choice there.
And one other that comes